Hello and welcome to the ALCSI podcast, where we share the stories of lung cancer patients and their caregivers, as well as the work of doctors and researchers in the field. Today, we have the great honor and privilege of having Dr. Aurora Lucas with us. Dr. Lucas is a Filipina American lung cancer survivor, educator, and independent consultant deeply committed to health equity, inclusive storytelling, and culturally responsive advocacy. Diagnosed with stage IIIA non-small cell lung cancer at 28 while completing her doctorate and teaching full-time. Aurora experienced delays in diagnosis due to her age, gender, and insurance barriers. That experience now fuels her work to uplift historically marginalized voices, particularly young women of color navigating systems not designed for them. As a learning specialist and community-driven leader, Aurora empowers others through education while also working to bridge gaps in healthcare. Her story and advocacy has been featured by CNN, NBC News, CBS, the Tamron Hall Show, and other national platforms. She continues to use her voice to ensure patients feel informed, represented, and empowered. Aurora, we are so honored to have you on our podcast today. Thank you for your time.
Thank you so much for having me.
Of course. To introduce the moderators today, my name is Sam Schwartz.
My name is Pranav Mandiam.
My name is Jacob Rashab.
And I'm Priyanka Senthil, and we are with the American Lung Cancer Screening Initiative, a national 501(c)(3) nonprofit working to raise awareness of and access to lung cancer screening. Aurora, to start us off today, can you tell us a little bit about yourself and your story?
First of all, thank you all for the work that you do and for taking the time to even do this. To start off, I think I could take you guys back to the year 2021. I was actually looking through my photos today and I was getting back from my vacation with my cousins in Tulum, Mexico. And I remember having the time of our lives. And then I didn't know that just a month later, I would start experiencing symptoms such as chest pain, fatigue, backache. But I was 28 going after all of my dreams, all of the things you're supposed to do as a 28-year-old, like climbing the, career ladder, whatever that is. I thought it was just me overworking myself. I would push it off. I also grew up in an immigrant family, so I was like, okay, just like push through it, it'll go away, I'll rest later. That was my whole mentality. And when school was coming back, this is when all the students were coming back from remote learning. I started having chest pains again. The chest pain showed up once during the summer, but then when the school year started, the chest pain lingered for more than 24 hours. And I was still trying to push it off, but it was my students and my coworkers who were like, Aurora, like something is wrong. Might have been the fact that I couldn't talk like the way I'm doing now. Every other word I would be coughing. I couldn't really looking back, I don't think I was doing my job very well because I was just coughing and not really being able to lecture. But I finally went to the doctor, and I was like, okay. So going to the doctor was a big deal because I don't like going to the doctor and I don't like taking time off. But right away, when I told him my symptoms, he said, "Oh, you look great. Please like just go home, boil some water and add some honey." And I remember just like staring at him and I was like, no, like that, like my whole body was saying that's not right, but the words wouldn't come out of my mouth. Because in my head, I was like, well, he's licensed, he's gone to school for decades, right? In order to become my primary care physician. Maybe he is right. So even though my body was kind of saying like red flag, that's not right. Something is wrong here. Still, I was in the mode of like, let's respect the doctor. He is probably right. So I went home, tried to go home or tried to go about my life as normal. And yeah, it just kind of snowballed from there and the symptoms kept getting worse.
Well, thank you. Thank you so much for sharing your story with us. We actually, we see a lot of trends recently of younger and younger individuals actually getting diagnosed with lung cancer, even if they never had a smoking history. And obviously, they would not fit the guidelines for a low dose CT scan because they do not fit in that 50 to 80 year old range. And they certainly don't have the smoking history of 20 pack years to back it up. So it's unfortunate that we're seeing younger and younger individuals like yourself getting diagnosed with lung cancer. And you mentioned a little bit that your symptoms were first dismissed by your primary care physician. Could you tell us a little bit more about what that experience was like and how did it shape your journey early on?
Yeah, I think that looking back right away when my symptoms were dismissed, it kind of affirmed my beliefs about the healthcare system, about, women of color being dismissed. But I don't think I would have worded it that way back then. I think I was in the mode of still respecting his, who he was as a doctor, right? And also being in denial of the fact, I was like, maybe it's, I was going through trying to rationalize what was going on in my body. And the world was still in the COVID era, even though it was starting to open up. I was like, maybe it's something post-COVID. Maybe I had COVID without knowing it because I didn't actually have COVID during the time that the world was like shut down. So I had a list of stuff. So it was like between me and then my doctor saying like nothing was wrong. Um, so that was the beginning, but it wasn't that he just like dismissed it that one time. It was actually, as we'll talk more about my story, it was 3 months of him denying the exams that I needed, like the PET scan or a CT scan. Yeah.
That's really I understand it's super difficult to like go through that where if your physician who you trust and believe that knows all the information is denying your scans and your the next steps for your diagnosis. And I understand that's like super difficult. And eventually, how long did it take for you to receive your diagnosis of lung cancer?
Yeah, I saw my primary care physician around September, and it wasn't until December 6th, 2021 that I was able to receive my diagnosis. So it took months of me and my family speaking up for me because they knew. So they actually work in healthcare. They were like, if you are in there by yourself, you are an Asian woman, they're gonna think you are not gonna speak up. So you need people with you. Like we started having to make action plans. It was kind of, the word would be crazy. I was like, really? Like we have to do all this? Isn't this kind of, the word would be reaching, right? Isn't this like overreacting? They're like, no, like you literally need people in those hospital rooms with you for them to take you seriously.
Yeah, that is really difficult. And
Mhm.
when you did get your diagnosis, I believe it's a stage IIIA lung cancer with the EGFR mutation. Could you
Mhm.
walk into that time about like finally getting your answer after all these delays? And what were some of the treatment options that were offered to you at that point?
Yeah, so I was only able to get my diagnosis because so I previously had the HMO insurance, which I needed my PCP doctor every step of the way, and he kept just like denying it or ignoring it, right? And then there was the time frame of, sorry, my dog's here, November and December. There's a window where you could change your health insurance. And finally, December 1st, me and my family were like, oh my gosh, I could change my healthcare team. I have the PPO insurance. I could choose whoever I want. So we finally went to like a different team, a different hospital. And from December 1st, I just word vomited to the new primary care physician. And he was like, oh my gosh, like that was his reaction. And then he expedited everything. So from December 1st to December 6th, it took only 6 days for me to finally get diagnosed versus the 3 months beforehand of just like begging for those exams. And I remember when the doctor walked in, he was like just staring at me. He looked so exhausted. I was like, yeah, I think everybody's exhausted in healthcare. And I was like, it's cancer, isn't it? And he's like, yeah, it is. And we both just kind of had that moment. And I said, okay, and what stage? And he was like, it's stage three. And when he said stage three, I was like, how could that be possible? Because was still thinking of my first x-ray. There was only like one small nodule. So by that time, it had grown to stage 3A. And so they did like all the scans, whole body, but there was only cancer on one side, which is on my right side. Um, yeah, so there was that. And then telling my whole family, I was okay with it because I don't know. I grew up, yeah, had a hard childhood or whatever. I was like, okay, it's cancer. Like I was so exhausted at that point. But it was my family and seeing my dad. He came to the hospital. I was like, Dad. He's like, what is it? He's like, is it tuberculosis? They were still in denial. They were like, it might be tuberculosis, it might be this. And I was like, Dad, it's lung cancer. And you could see his face turn purple. He wanted to cry, but men in my culture, they don't really cry. And he's just like trying to hyperventilate. And then when I said stage 3, he's like, yeah, you could just see like the blood leaving his face. And it was kind of like that with every single uncle, every aunt that I had to tell because I have a really big family. Um, and then, so with the EGFR mutation, it was the next day when my oncologist was like, we're gonna have to test you for mutations. And then that set me off because I was like, what do you mean mutations? I already have lung cancer. Like, what else could there be? Could there be something worse? And she said, no, 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 it's something that's actually going to help us map out your treatment. I said, you could have said that in the beginning. I was like, maybe don't use the word mutation because it made me think of like the Hulk, It made me think I was going to turn into something that I couldn't recognize. So yeah. And the other part of the question you said, what were the treatment options offered to me? So wherever I got diagnosed, it was still a community hospital, and my oncologist, she was a generalist. So she worked with all kinds of cancers. So she was like, we're gonna be as aggressive as possible. We're gonna do 6 rounds of chemo, 30 days of radiation, surgery, and targeted therapy. I said, okay, let's do this, like ready to fight cancer. And as I went through that process of going back and forth between different appointments, for the following 2 weeks, I kept meeting people who were like, Aurora, whatever you have is not normal. And I said, what do you mean? Like, young people are getting cancer. And they were like, not lung cancer, not at this age. So maybe you should go to a specialist. I said, I'm exhausted. Like, my in my head, like red sirens were going off. I was like, F no, like, I'm not doing anything more. I'm just gonna go and get treatment. But I kept meeting like wonderful, I consider them angels now. They're like, you should go to a lung cancer specialist who knows what to do in your situation. So finally I went to a research hospital in Chicago, and right away the oncologist was like, we should just do 2 rounds of chemo. And I wanted to fight him. I was like, what do you mean 2 rounds? Like, that's not gonna work. And he's like, oh, I get it. I get how you're feeling. You want to go as aggressive as possible, but I've been doing this for 40 years. He was like, I don't treat breast cancer patients or other kinds of cancers, only lung cancer. And I've worked with plenty of patients just like you. And I think when he said that, that gave me a sense of peace and clarity. And I was like, those people were right. Like I should transfer care again, after doing all of that. So I think that's a big piece as well. Even though I had EGFR, even though I had my diagnosis, there are other oncologists who are more experienced and actually care about your quality of life.
Well, that you talking about the story of you just hearing about the diagnosis and having to tell your family sounds like such a harrowing experience. So we really do appreciate you coming on here and speaking about that. And sort of transitioning, you've started to talk about the treatment process. So you've spoken about how your background and identity affected how you were treated during the diagnosis period. Did you feel that your background and identity also influenced how caregivers responded to you during the whole treatment process and receiving chemotherapy?
I was There was a huge difference being like in a top tier research hospital versus the community hospitals. I could tell that they were obviously more resourced in the research hospital, and I would assume better training. And also, it was in downtown Chicago. Well, I can't make assumptions because my other primary care physician was also in downtown Chicago. But I think they were just more resourced and probably better trained. They would respond to me in a better way. Even though I was young, they weren't dismissing my symptoms or they weren't dismissing me as a person. I actually felt more seen. And every time I go in there, even now, They take the time to actually get to know me. Even the person like flushing out my port, they actually care about who I am as a person. Versus when I was in a community hospital, everyone was just exhausted. Everyone was just, I think, kind of distanced from the work they were doing. Um, because now I try to see like their humanity, right? The healthcare workers. I'm like, they're probably beyond exhausted, under-resourced, understaffed in the community hospitals I was in versus in the research hospitals that I'm now in.
Thanks for sharing, Aurora. And what really just sticks out to me is just having to transfer care teams 3 times. And I can only imagine how difficult that is, having to build a connection, build rapport, build, trust with each team over again. It sounds like it was a really, just draining process. And hearing you talk about how you just wanted to, want to just get the treatment done, I can really empathize with that because, when you're going through something like lung cancer, I'm sure you just want to get it treated, just want to be able to move on and get it taken care of as soon as possible. So just hearing your story, I think is it's really helpful, and I know that there are a lot of patients who can sympathize with what you went through, unfortunately, because that having to transfer these care teams and just the entire process is oftentimes really drawn out. So really appreciate you sharing that perspective. In terms of your treatment with chemotherapy and then also radiation, could you talk about if there was anything you wish you had known beforehand, and just in general how your experience was with both of those treatments?
Hmm. Um, Preparing for chemo and radiation, I think. So before you do chemotherapy and radiation, it's like you have to take classes, right? Meeting the people who are gonna do chemotherapy or the person mapping out your radiation treatment. So I feel like I was actually over prepared. And at that time, I was just kind of going through the motions at that point because I was just so exhausted with the whole process of even trying to get diagnosed. So something I wish I had known beforehand, was I thought I could rest, but I think I remember during that time I still had to fight my insurance for, I don't remember the medication, but like protecting my ovaries and the eggs. Um, I remember having to pay out of pocket just because insurance was taking forever. So I think I would have gone back and told myself, like, hang in there. It's not time to rest yet, and actually vocalize, tell your family that you still need help. Because at that point, I think I'm also very independent. I hated asking people for help. Um, I would have said, like, maybe tell people like what's going on instead of trying to do this independently.
I just want to touch on one of the things that you said and about fighting your insurance for medication regarding your ovaries and eggs. When we had our previous meeting, our pre-production meeting, you mentioned that you actually had to consider fertility treatment before starting chemotherapy, which
Mhm.
is less common with lung cancer patients, given their older age at diagnosis. Can you talk to us a little bit about what that process was like?
Yeah, it was my female oncologist in that community hospital that mentioned having fertility treatment. And I was like, I remember breaking down. I was like on the floor crying. I was like, you are literally the first person that talked about this. And I was, I think, just like in the dark of even, I felt afraid asking about fertility treatment because I know that I was supposed to be fighting for my life. Like, how could I want to even grow a family if I have to fight for my own life? But she was like, if this is important to you, we could delay your treatment. And so there was that. And I remember even finally getting to that specialist for fertility. I still had to fight for the medications that were needed in order to freeze my eggs. They were actually so kind. I remember there was stuff they were just like, okay, we can't fight insurance anymore. These are gonna be donated from our facility. I remember that moment and I was just like, really? Like you guys are just like donating the stuff, and they were like, yeah, there's a pile where, we know your situation. So there was like that back and forth of like insurance didn't provide everything. I don't remember exactly, but I remember just like being on the phone with them, and there was some medications that they had like donated just so I could make sure that I could freeze my eggs.
Yeah, I think that's so great that your care team was able to talk to you about like fertility treatment and helping support the all your decisions despite like all insurance issues that you had. And
Yeah.
I know that you talked about after switching these three care teams and your initial experience with your first primary care physician, that you started to lose some trust in the healthcare system and in your physicians. And now that you were now after the three switches, you're with a care team that you do trust. How are you able to rebuild this trust with the healthcare system and with your care team?
Yeah, I think that they saw probably how exhausted I was. And every time I was in that clinic with them, because I would have to meet like with my radiation oncologist, I would take the time to ask them questions, actually. I'm like, why are you, why did you choose this career? Like I was genuinely concerned for them as well. After seeing everybody so exhausted, I would start being curious, like, oh, you mentioned you have two kids, I would try to humanize them because I noticed that, you know, as a teacher too, you're just trying to go through all of the motions. I was like, what could I do to like make this easier for me and for them? And I would start asking about their family, their hobbies, and when they would talk about that, they would actually like, I was like, how many people actually ask them this stuff? Um, I don't know if all patients would want to do that, but it's just something that also fulfills me, like getting to know them and why, because I was like, why would they do this? It's such a difficult job, like especially lung cancer. Everyone's dying like left and right. And that's when they were like, no, it's actually a hopeful time in research. We're finding more and more like treatments and more people are surviving. And they mentioned that they're used to patients being super defensive by the time we get to their healthcare team. They're like, yeah, a lot of people are on the defense mode by the time they get to us. So I think that they were used to it, like having somebody be on the defense mode by the time they get there. Um, I don't distrust my healthcare team, but I still have a great distrust in insurance. Like there's still that trauma lingering in my life now.
I will say, I think it's just amazing that even in this time of difficulty for you as you're undergoing treatment, you still sort of think about your providers and how they're doing, caring for their well-being. So, I just want to say that's really considerate of you, and that's fantastic to hear. And sort of switching gears, so you've mentioned again not seeing many people who looked like you in the lung cancer space. So I just want to ask, how did you go about finding a supportive community during this time?
Yeah, I went through, I would say, a year of darkness and recovery after chemo and radiation. I would see the signs in the hospital. They're like, oh, what is it called? Like a supportive call or something like that. I was like, why would I want to be in a circle of people talking about lung cancer? Like, I don't think that's good for me. So I would just like look at it. And then there's a website called Rare Patient Voice. They actually pay patients to be in those supportive like communities. And so I signed up for it and I got accepted. And then there were a range of people in that call, but there was one girl, she looked so young. I remember sending her like a private message. I was like, I've never seen anybody that looked like me or was my age. Like, could we start exchanging text messages? And we became really, really good friends. And then from those group calls, I also found out that there are Facebook groups. So then there's the Tigrisso group. I'm like, okay, I joined it, but never posted. But I was like, there is this team of people who are a range of like diversity and like their background, but also wealth. That's the big thing about Facebook groups is like people who have access to the best doctors are sharing their treatment options and like how they're able to access their doctors. Um, so that's how I found it helpful. And now the one that I'm really involved in is in social media and I don't know if you guys have heard of Young Lung Cancer Initiative. Yeah, they're a mainly Facebook, but also they're on Instagram. But they did not exist when I was diagnosed, but now I'm so happy that they exist because now I'm surrounded by a lot of other young lung cancer patients, and we're just constantly posting on social media to make ourselves visible.
That's so amazing to hear, Aurora, and just having the opportunity to talk with so many patients. I think the support groups, either in person or online, those really make such a big difference. And I know that for a lot of patients, it's scary to get involved at first. You're putting yourself in a very vulnerable position, but just hearing other people's stories and hearing what they've gone through, getting that advice, having that space to really talk about what you're going through, because I think, no one probably understands what you've gone through more than another patient who's, who's very similar to you. So we really just admire and appreciate all of the work that you're doing online and on social media. So it's really our honor to be able to hear your story and share it with our audience today. And
Thank
on that
you.
note, many of our listeners are student advocates. And so we wanted to ask you if you had any advice to give to our students who are hoping to, advocate for lung cancer or even just another cause such as lung cancer.
Yeah, I would say I think that student advocates today, you guys have a gift, especially with social media. And what I've seen is that other generations don't have that gift. And I think people my age and your age take it like I wouldn't say take for granted, but we see it as something so normal. But like recognizing the gifts that you may have, like speaking in front of a camera. And if you don't like that, there's other ways that I think our younger generations that we don't always recognize those gifts that could actually really advance the awareness for lung cancer. Because I've gone to a lot of conferences and they keep saying there's not enough awareness. And I'm like, there's a lot of tools that we have that we could actually use to advance awareness. Also, the other thing, I've gotten yelled at by doctors, which I did not expect as well. The internet world can be really nice, but there are people who are really mean, so please be prepared for that. There's people who are racist out there or just like saying like you shouldn't have a COVID shot. So I think I've learned how to navigate and just like turn off my phone. So even though we have all of those gifts, also while you are advocating for lung cancer, know how to protect your peace. That's the gift with a phone, right? You could just turn it off, like share your message out there and then turn it off when needed. But I think starting with what gifts do you have within you that could help advance awareness and lung cancer screening? Because we know that it's outdated. And know that you might get yelled at by some people and I just stare at them and I'm like, okay, like I know what I'm talking about.
Yeah, I want to follow up with you a little bit more about that with my next question. But before I do, actually, about a year ago, I think the young lung cancer actually followed me on Instagram. So I've been lucky enough to look at some of the posts. And actually, right after we finished our meeting about a month ago, your post popped up on my feed. So I was lucky enough to get to see a little bit more about your story, which was amazing. And social media is truly so powerful because if I was not meeting with you, if I was not fortunate enough to see his account before, I truly would never have known that the growing number of young individuals developing lung cancer, not something that would even have crossed my mind. So I
Mhm.
completely agree with you that social media, especially in younger generations, can absolutely be a tool to spread education. Um, and so to touch on a little bit about the last thing you said, as we know, there's a lot of misinformation out there, especially online. As a survivor and advocate, what advice do you have for patients trying to navigate, in some ways, this very difficult field of misinformation? You say sometimes doctors have attacked you, even racism at some cases.
Yeah, I would say coming from somebody that has a great distrust, I think in the healthcare field. And also I've been like reflecting on that. I'm like, oh, my family has had even though they work in the healthcare field, there's a huge distrust there. I think a lot of patients should connect with other patients because we do get patients who ask like maybe I should not do chemo, maybe I shouldn't do, these things. And then there's even information out there that says like don't do another COVID shot or you should. The most recent one that I was sent by a family member actually was like I think it was something with dog medication and I was like what is going on? Like who is coming up with this stuff? But I think that if they find a good doctor that they trust and they feel like they could trust, listen to them. Um, that if there's a doctor like mine, a primary care physician that they couldn't trust, that they could literally just go and find a different one. I know it's like really, really difficult with insurance, but I think they have to be creative in finding somebody or a group that they could trust. Because I wouldn't be the person that says like you should take that medication or something holistic. Like I would still trust the people who are like in the forefront of battling the disease. Because some people are very distrusting or also a lack of resources. That's one big thing in the young lung cancer group. A lot of Americans yelled at people. I think she was from the Philippines and she's like, what fruits could I eat or something? And right away when I saw the post, I was like, she's not trying to have misinformation. I don't think she has access to Tagrisso, which is a lot of thousands of dollars. So I think if patients could find somebody that they trust and I guess somehow navigate on how to get the treatment, I would say do that. But also I think for other patients I think the discernment, right? If somebody has access to that medication or if they're coming from a place where they literally cannot access the medication that they need.
Yeah, thank you so much for your story and giving that advice. And I think that navigating the healthcare field and especially trust in the healthcare field is so important. It's also so difficult to do as well. I know a lot of our listeners would be really interested in connecting with you as well. So I was wondering if you could drop some of your like how our listeners can connect with you.
Yeah, definitely. Well, I guess two things I'm really super active in is Instagram and TikTok. I'm very open to direct messages because I always think I want to be the person that was, that patient 3 years ago that needed somebody or, a group of people. I'm always very open to talking to people. There's a bunch of messages that I need to like catch up with, but they could actually just direct message me and I can help them find resources or just be that safe space because even though, young lung cancer exists, there's still a lot of need for like having that safe space or just like somebody to talk to. So they can look for me on Instagram, it's Dr. Aurora Lucas on Instagram. And I think on TikTok is Aurora Lucas. So they could comment or just direct message me, but they're more than welcome.
Awesome. Thank you. And it truly has been a pleasure to talk to you with you, Aurora, today and learn from the wealth of knowledge and experience that you have as a lung cancer advocate. We appreciate all the work that you've been doing for the lung cancer community as well. And along with that, thank you for our listeners to joining us on this episode of the ALCSI podcast. We hope you enjoyed it. Please keep an eye out for our upcoming podcasts and events, which will be posted on our website, www.alcsci.org. Thank you and have a great day, everyone.